Osteoarthritis, a group of conditions causing inflammation and pain in joints. Symptoms include swelling, stiffness, and decreased mobility. Types include osteoarthritis, rheumatoid arthritis, and gout. Treatment involves pain relief, physical therapy, and sometimes medications or surgery to improve joint function and reduce inflammation. Fracture, a break or crack in a bone caused by trauma, injury, or disease. Symptoms include pain, swelling, and difficulty moving the affected area. Treatment varies depending on the severity, with options such as casts, splints, or surgery to realign and stabilize the bone. Gout, a form of arthritis caused by excess uric acid, which forms crystals in the joints, typically the big toe. It leads to intense pain, swelling, and redness. Gout attacks can be managed with medications to lower uric acid levels and lifestyle changes. Sprain, an injury to a ligament caused by stretching or tearing due to excessive force. Commonly occurs in the ankles, knees, or wrists. Symptoms include pain, swelling, bruising, and limited movement. Treatment often involves rest, ice, compression, and elevation, RI, along with pain management. Strain, a muscle or tendon injury caused by overstretching or tearing due to excessive force or overuse. Symptoms include muscle pain, weakness, swelling, and difficulty moving the affected area. Treatment involves rest, ice, compression, and physical therapy to restore strength and flexibility. Dystrophy, a group of genetic diseases characterized by progressive muscle weakness and degeneration. Muscular dystrophy affects muscle function, often starting in childhood. Symptoms include difficulty walking, breathing problems, and muscle wasting. While there's no cure, treatment focuses on managing symptoms and improving quality of life. Osteoporosis, a condition where bones become weak and brittle due to a loss of bone density, making them more prone to fractures. It often occurs in older adults, particularly postmenopausal women. Treatment includes calcium and vitamin D supplements, medications, and weight-bearing exercises to strengthen bones. Arthroplasty, surgical replacement of a joint, typically the hip or knee, to relieve pain and restore function, often due to arthritis or injury. The procedure involves replacing damaged joint surfaces with artificial components made from metal, plastic, or ceramic to improve mobility and reduce discomfort. Traction, a therapeutic method used to align and immobilize bones or joints, often after fractures or dislocations. It involves pulling forces applied to the body to stretch and stabilize the affected area. Traction can be either skeletal or skin-based, depending on the severity of the injury. Ligament, a band of fibrous tissue that connects bones to other bones at a joint, providing stability and preventing excessive movement. Ligaments can be injured through overstretching, leading to sprains. Ligaments are crucial in maintaining joint integrity and supporting the body's skeletal structure. Cartilage, a flexible, rubbery tissue found in joints, the nose, and ears. Cartilage acts as a cushion, reducing friction and allowing smooth movement between bones. It also provides structural support. Damage to cartilage, such as in osteoarthritis, can lead to pain and limited joint mobility. Tendon, a tough, fibrous tissue that connects muscles to bones, enabling movement by transmitting the force from muscle contractions. Tendons can be injured through overuse or sudden force, leading to strains or tears. Proper rest, rehabilitation, and in severe cases, surgery are used for treatment. Myelopathy, a disorder of the spinal cord that can cause neurological symptoms such as weakness, numbness, and difficulty walking. It can be caused by compression, degeneration, or injury to the spinal cord. Treatment often involves surgery, physical therapy, and medication to manage symptoms and prevent further damage. Spondylosis, a degenerative condition affecting the spine, typically due to age-related wear and tear. It involves the breakdown of discs, ligaments, and joints, leading to pain, stiffness, and sometimes nerve compression. Symptoms can be managed with physical therapy, medications, and lifestyle modifications to reduce discomfort. Internal fixation, a surgical method used to stabilize and align broken bones using pins, plates, screws, or rods. It helps ensure proper healing by holding bone fragments in place, reducing movement, and promoting faster recovery. Often used for complex fractures requiring surgical intervention. Arthrography, a diagnostic imaging procedure where contrast dye is injected into a joint to create detailed X-ray or MRI images. It helps visualize joint structures like cartilage, ligaments, and tendons, aiding in the diagnosis of conditions such as tears, arthritis, or joint instability. Rheumatoid arthritis, an autoimmune disorder that causes chronic inflammation in joints, leading to pain, swelling, and stiffness. It primarily affects the hands, wrists, and knees. The immune system mistakenly attacks healthy tissues, and treatment includes medications, physical therapy, and sometimes surgery to manage symptoms.